Good morning, everyone. Can everyone hear me clearly? My name's Anne Hannah, and I'm the chair of the Integration Joint Board Performance Audit and Assurance Committee. And it's being held today here in Grangemouth, but we're also online. So it's being live streamed publicly, and some of the people are here online. So welcome to one and all. I'm conscious that there are one or two unfamiliar faces, so when it does come time for people to speak, if they could introduce themselves, it would be helpful for both myself and for anyone who's watching. I also understand that Stephen is one of the other IGME members who's online, has got limited time this morning. So forgive me if I appear. I will make sure that we deal with every item fully, but I will be trying to move through them quickly so that we can get through all the important items that we have on the agenda before Stephen has to leave at, what time did you say? 11:40. Right. So that because in the nature of the committee, we have to be very clear about having the correct number of voting members present. So without further ado, I do want to make mention, first of all, about the COVID report, which was published yesterday. And I think it requires some comment, given the nature of the people that the Health and Social Care Partnership deals with, and just to give some thought to the thousands of people who sadly didn't make it through the COVID pandemic, and to their families who are currently grieving. I would also like to ask that a report be brought to the Performance Audit and Assurance Committee just to highlight any lessons that we should be learning from the report that has been published. So thank you for that. Right, we go to, first of all, apologies. Do we have any apologies?
Thank you, Chair. We have apologies from Councillor Flynn.
Okay, thank you. Any declarations of interest in relation to any of the items on this agenda? No interest whatsoever. Okay, so we'll move on to the action log. Sorry, the minute. I'm not doing very well. That's me trying to speed through the agenda. We'll go to the minute of the previous meeting, which was the meeting on the 26th of September. First of all, can I have assurance that people regard it as a correct minute? Okay, I'll take the silence as an assent. And does anyone have any matters arising from that minute? No matters arising. So we have agreed that minute. So we can now move on to the rolling action log. Is there anything that needs to be highlighted on the rolling action log?
Just to confirm, there's no open items at the moment. We have one closed item that's been highlighted around reviewing terms of reference, which was completed at the last pack.
Okay, thank you very much. So we'll now move on to the IJB 2024-25 audited annual accounts, and I think this is for you, Marie.
Thanks, Chair. I'll just introduce the cover report and then I'll hand over to Pauline Gillen from Audit Scotland, who's here to present the audit report today. So this is to present the 24-25 audited annual accounts. So the draft annual accounts were submitted to external audit by the 30th of June in line with timescales. The annual accounts, the audit has now been conducted and the reports are included as appendices. I just wanted to issue my thanks to the senior accountant and to the partner finance teams for their assistance in preparing the accounts this year and for their help throughout the audit process as well. And I'll just hand over to Pauline, who will present their report. Thank you.
Thank you, Marie. Pauline.
Thank you, and good morning, everyone. Yes, so if we just turn first of all to the covering paper that's in the appendices, this paper is addressed to this committee as those charged with governance under ISA 260. The most important thing in this letter is at paragraph 1, where I confirm that the work we carried out on the annual report and accounts is now complete, and subject to approval and final checks, I'll be in a position to provide a clean audit opinion, hopefully later on today. You'll see Appendix A, there is a copy for your information of the proposed independent auditor's report, which has now been inserted into the accounts that you've got in front of you today. The auditing standards require me to bring to this committee's attention any significant findings or audit issues that we identified during the audit, and I'll come on to that in a second when I move on to the annual audit report itself. I'm also required to bring to your attention any unadjusted misstatements that we identified in the accounts over the reporting threshold. For the IGB, that's £260,000, and I can confirm that there are no uncorrected misstatements to bring to your attention. I'm also required to confirm from the committee at paragraph 7, you'll see there a number of bullet points, just assurances to receive from this committee before I can sign the accounts. I've not been advised of any matters in relation to any of those bullets, but just a short pause to confirm that that remains the case before I proceed. Okay, thank you. Take silence as assent.
Indeed.
Thank you. So just moving on through the remainder of the letter, Appendix B is noted there at paragraph 10. We have the letter of management representation, which members will have seen in previous years. This is a standard letter that provides me as the auditor with a number of assurances from the Section 95 officer that be signed at the same time as the accounts are signed, hopefully later on today. At paragraph 11, at time of writing, we included one outstanding matter. As part of our audit procedures, we receive letters of assurance from the external auditors of Falkirk Council, which is myself, and the auditors of NHS Forth Valley. And at time of writing, the Forth Valley assurances were outstanding, but we've received those from the external auditors. So I can just confirm that all outstanding information has now been received. So there's nothing to prevent us from signing the accounts. So I move on to the annual audit report itself. Annual audit report essentially summarises the work that was carried out during the 24-25 audit. And you'll see there it covers the audit of the annual report and accounts themselves, but it also covers the 4 wider codes, code dimensions that are covered by public sector audit in Scotland, and also best value. If you turn first of all to Exhibit 1 of the report, where we just remind members of the materiality levels that we set for the audit, and which drives the work that we do. You'll see there overall materiality set at 2% of gross expenditure, which is a standard level for an organisation such as IJB. So that equates to £6.5 million. We also have a reporting threshold of 4% of that overall materiality figure of £260,000. As I mentioned earlier, that's the point at which we would bring to your attention any misstatements in the accounts. But as mentioned earlier, there were no misstatements in the accounts that we have to bring to your attention. At Exhibit 2 of the report, I outline the significant risk of material misstatement that was identified as part of our planning and was included in the annual audit plan that members will have seen earlier in the year. There's only one risk in this exhibit, and this is a standard risk that we include in all of our audits, and it just represents the ability that management have to override any financial controls, and it's a standard risk that we address in all of our audits. You'll see there in the middle column, we have a number of audit procedures that we carried out during the year, including those assurances from external auditors, and also the outcome of the audit work there, where we confirm that there were no issues that arose from the work that we carried out and nothing to suggest management override of controls. The remainder of the report covers our wider scope and best value areas. And you'll see there that we comment positively on the IGB's financial management, vision, leadership and governance, and use of resources. As you would expect, we've got a lot of detail in there around financial sustainability. We note that for the period 25-26 to 28-29, as outlined in the medium-term financial plan, management have identified a budget gap of just over £20 million. We also note, along with many other IJBs, the continuing use of reserves year on year, and you'll see the reserve balances continue to reduce. We note that this is not a sustainable way of managing financial challenges, and it's very much a short-term approach. We do note the work that has been taken to identify savings measures, and you'll see Exhibit 3, we've outlined a number of the significant saving measures that are planned for 25-26, and we will report on delivery of those in the 25-26 audit. We know also that there's work underway to finalise the revised integration scheme and strategic plan for the board, both of which are expected to be in place for 25-26. And again, we'll report on that in next year's audit. In relation to the significant financial pressures, you'll see there at paragraph 45, we have included a recommendation that the board should continue its efforts to identify and deliver sustainable savings measures. This is similar to recommendations we've had in previous years. The action plan at the end of the report follows up on a similar recommendation from last year and supersedes it for this year. So that's a recommendation that we will carry forward into 25-26. That was all I'd want to say. In the action plan at the back, you'll see that there only are two recommendations, one of which is the financial sustainability one that we are carrying forward to next year. That was all I wanted to say on the report. I just wanted to extend my thanks to everyone for all their assistance to the audit team in helping us get to this position. I'd mentioned, I think, in a previous committee about our intention to try and bring the timetable forward to be more closely aligned to the council timetable. So as we start our planning for the 25-26 audit, the team will be in touch to talk about timetables for next year. So hopefully this signing off the accounts will be done a bit earlier for 25-26. I'm happy to take any questions or comments on the report. Thank you.
Thank you very much, Pauline, and thank you to all the officers who have been involved in the preparation of this rather weighty document. I recognise that it has taken a considerable amount of time, and I really appreciate the commitment to trying to align the audit process and get things dealt with at an earlier stage. Does anyone have any questions or comments they want to make? I think that's Stephen's hand I'm seeing. It's actually quite difficult to see from here.
Thanks, Chair. No, just echoing that, really good report. Well done to everybody. Obviously, some challenges ahead, particularly in relation to our reserves, but I know it's been a lot of hard work, and that's a really good audit report. When you consider the challenging circumstances. So excellent, well done to everyone.
Thank you, Stephen. Yes, I think in terms of the financial sustainability, we have heard the bad news on this so many times. We almost become numb to it. But clearly it is a significant issue and gives a great deal of concern to those who are tasked with dealing with it. Any other questions or comments? If I can find the correct page. I moved away from it, now I have to move back to it. The comparisons of where we stand in terms of the Scottish situation gave me some concern, given the number of situations where we are deemed as not meeting the average. I wonder if anybody would be able to say something about that. If you can help me find the page first. 93, thank you.
So is that around the performance
The
indicator?
performance indicator. Sorry, yeah.
So that's going to, so Callum's going to present the performance report next.
That's coming next, okay.
I know that's reviewed fairly regularly by PAC committee, so there's a regular performance report brought. So maybe Callum can comment on those performance indicators when he's covering his report. Is that all right?
That's fine, thank you very much. Anybody else got any questions or comments? I see no hands and no lights. So can we return then to the recommendations, which are that we approve the audited annual accounts of the IJB to 31st March 2025, that we note and consider the content of the covering letter and IJB audit opinion Appendix 2, that we consider the external audit annual report Appendix 3, that we note the ISA 580 letter of representation at Appendix 4. Can we agree that we have done all of that? I'll agree with myself. Agreed. So we'll move on to the next item on the agenda, which is the performance monitoring report. Callum, I think, is online to deal with this.
Thank you, Chair, and good morning, members of the committee. I'm here this morning to present the performance monitoring report, and of course, very happy to take any comments or questions that you might have. Performance is reported up to September 25, and with a year-on-year comparison, we have detailed exception reports for the following areas. So there's exception reports for emergency department 4-hour access, compliance, delayed discharges, attendance management across both NHS and council partnership services, psychological therapies waiting times, and waiting for the number of people, waiting for a care at home package. I'm not going to go into detail of all of these, but I'm just going to pick out a few areas to highlight to the committee. So firstly, the emergency department 4-hour access compliance, the data showed a year-on-year increase in the percentage meeting the target. However, just to note that that has largely been a result of a change in the definitions and what would be or what should be included at national level. Without that change, the compliance would have been very similar to the previous year. For delayed discharges, if we look at the total delays, the position at the end of September 25 of 67 delays is very similar to the position of the year before, where there were 65 delays. And I think just looking at those two data points doesn't perhaps fully illustrate the progress made. But chart 2 on page 13 of Appendix 1 of my report shows that the progress made in relation to standard delayed discharges since early summer through the shifting the balance of the care project. And I know that appears later on the agenda this morning, and you'll be hearing more about that. We've included an exception report in relation to the number of individuals assessed and waiting for a package of care. At the end of September 25, there were 39 individuals waiting for a package, and that's compared to 16 the previous year. I'd just like to add some background and context to that, and I think it's important to note that progress has been made in that area in recent years. Previously, the numbers waiting had been in triple figures, but our waiting list position now compares well to our comparators and to the national average. The increase that we've seen in the numbers waiting is related to the challenging financial position. For assurance to the committee, there are weekly allocation meetings held, and that's overseen by senior managers in order to ensure that those with the greatest level of need are prioritised and are able to access care. What was previously the complaints and feedback report can be found starting at page 22 of Appendix 1 and provides information for the period July to September 25. The report details there was 109 complaints received via the Council's complaint handling procedure and 268 complaints received via the NHS complaints handling procedure during the reporting period. And just to note that the NHS figure now includes prison healthcare complaints, which was previously not included. We had 4 people take the time to provide positive feedback directly to Falkirk Council Health and Social Care Partnership Services during July to September, and the equivalent figure for NHS was 19 people providing positive feedback. So in terms of recommendations, the board is asked to consider and comment on the content of the report and to note that appropriate actions continue to be taken to address the issues identified. Thank you very much for listening to me, and I'm happy to take any questions or comments that you might have.
Thank you, Callum. Does anyone have questions or comments? Marie?
Yeah, thanks, Councillor Hannah. Just in relation to your question from the previous report, Callum, the Councillor Hannah had a question around those areas in the national indicators where we're performing less well than other councils. So that was just for noting, it was on page 93, and I'd mentioned that you're bringing regular reports, but that I realise that comes in your annual report, those national indicators. I just wondered whether you might have any comments around those ones where we were performing less well in comparison to others. Thanks.
Yes, happy to cover that. So as Marie has pointed out, those indicators appeared in our, or they appear every year on our annual performance report. So they're indicators that we are familiar with. Some of them also make up our regular performance reporting as well. I'll start with the kind of second half of those indicators, if that's okay. So that's 11 to 19. And they largely relate to some of the secondary care hospitals, so that we have emergency admission rates, readmission rates, and delayed discharges as well. So these are areas that we know have, not just recently, have traditionally been a challenge for ourselves, but they are also areas that receive significant focus and effort, and we monitor very, very regularly. Indicators 1 to 9, they relate to the Health and Care Experience Survey, which takes place every 2 years. So the last iteration, we're due a refresh of them for next year's annual performance report. And these ones haven't been refreshed since, well, they've only been refreshed once since after COVID. These were indicators that we traditionally performed very well pre-COVID, and I think what we've seen with after COVID and that survey coming out, that across the country, not just in ourselves, that all the percentages in terms of the kind of satisfaction levels, they all took a pretty significant decrease nationally. So as I said, next year we'll be due a refreshed version of these indicators, and it'll be really interesting to see how and if that position has changed. But yeah, indicators 1 to 9 have not been refreshed for a significant period of time.
I wonder if you could clarify what you mean by refreshed.
So thank you, Chair. It's a survey that takes place every 2 years. And it will be taking place actually round about now. So some of you may actually have had the letters through the door. It's a national survey, and it's a sample. Doesn't go to everybody. So when I say refreshed, that survey actually hasn't physically taken place for over 2 years now. It should be taking place just now, and we will get the results from that in around about the spring. And that will then feed into the national indicators, so those indicators 1 to 9, and that will feed into our annual performance report next year as well.
Okay, thank you. I may have more questions, but I think perhaps we wait until we get the next round. Roger?
Thanks, Chair. Just on the delayed discharge, from my own experience in the integrated mental health team, it's quite clear that although the shifting the balance of care has been great to shift the balance of care in some areas, it does create other bottlenecks, and I'm sure that's probably something that Caroline is aware of. And but I can see increases in delayed discharges in other areas, even though they've been removed in the standard delays, particularly in my own area of mental health and dementia.
Thank you, Roger. I think we may look into that in a little more detail. Do you want to come back on that, Karen?
Thank you, Chair. Just really to provide reassurance that we're doing a focused piece of work around tackling delays caused to AWI. So that's people that are delayed, that are going through the guardianship process. We already recognised that we had to do improvement work in that area. To that end, we've looked at resources around it. That's included locating a mental health officer within the Home First team, which sits under Claire Chapman, who's here today. And really what we've put in is an increased scrutiny and process around that cohort of individuals that are delayed, because we recognise that in terms of outcomes for the individuals, you really want to move them into the place that's more appropriate for them. So delays don't also impact on the system. They also impact on individuals, and we're very, very keen to make sure that we're working closely with families to improve the outcomes for individuals. So it's just to provide that reassurance around that bit of work that's taking place.
Thank you. Yes, I think that's a timely reminder that we regularly investigate the statistics, but there are very real people behind every single one of these figures, and we have to recognise that. Thank you. Stephen, you have a question or a comment?
Thanks, Chair. I just, in relation to the perennial challenges that the Health Board have in ED, one of the areas they actually perform very well in is minor injuries, and I think there is some evidence that it's been underused as a service, that people would rather just go to ED, and I don't know if it is our responsibility, or if there's anything that we could do to make our population aware of what minor injuries can and can't do, because I think that would help if we could push more patients in that area as opposed to ED. It's just food for thought. Thank you.
Thank you. Do you want to come in on that one, Gail?
Yeah, I think you raise a really important point, Stephen, in terms of there are lots of supports available to people depending on their needs, and sometimes it's not always clear to people in the community what the best place to go to is. So we work really closely with colleagues in NHS Forth Valley around the Know Who to Turn To campaign and promoting that. So if people, there's a range of supports. People can go to local pharmacies, can go to the minor injuries, and people obviously should only go to ED if they absolutely need to go there. So there's lots of different opportunities, and I think that we need to keep on continuing both through our organisations and individually to encourage people to use the right place at the right time for their care needs.
Thank you. Does anyone else have any questions or comments? I see no further questions. So we'll return to the recommendations on page 105. So we've been asked to consider and comment on the content of the performance monitoring report, to note that appropriate management actions continue to be taken to address the issues identified through these performance monitoring reports. Can we agree that we have done that? I'll take silence as agreement. Thank you. So we will move on to the next item on the agenda, which is the IJB Strategic Risk Register. And I think this is back to you, Marie.
Thank you, Chair. This is the regular update on the IJB Strategic Risk Register. No new risks have been added to the main register since the last version presented to the PAC Committee in September. There are currently 9 live risks recorded in the register. 1 is considered very high risk, being financial sustainability. 7 are high risk, and 1 is medium risk. The risk register will be continue to be maintained and reviewed on a regular basis while the outstanding reviews are carried out and implemented. Any updates will be incorporated into the revised register as they are developed and as the focused reviews commence. Appendix 5 has now been added to show a summary of children and families, the corporate risk register from the council, just for completeness and oversight. I know that the integration scheme is not signed off yet, but it was just thought it was advantageous to have this as an appendix, just as some oversight for the PAC Committee, given that the operational responsibility is sitting with us from this year. So I'll highlight a number of changes, starting at section 4.10. So under financial sustainability, this one has been updated to note that the budget strategy has been brought to the IJB with a view to moving towards agreeing and updating an updated business plan and a 5-year medium-term financial plan in March. The annual audit report also, which we've heard this morning on this morning's agenda, has also highlighted financial sustainability as a continuing risk for the IJB. Under partnerships, it's been updated to note the engagement and communications with partners and the development of an IJB market facilitation plan in line with the strategic plan development. Commissioning has been updated to include work to develop a comprehensive contract register, and that the Care at Home User Intelligence Group has now been convened in relation to the Care at Home framework renewal. Whole system transformation has been updated in relation to the Shift in the Balance of Care project, and resilience and business continuity. It's just worth noting that some work has been taken forward, but updates won't be brought back until the next committee due to some absence within the team. The risk strategy, the IJB risk strategy is due to be reviewed in 25-26, and this will include updating risk management roles, responsibilities and assurance reporting structures to reflect any changes to the integration scheme. And I've mentioned the children and families risks this morning, now added as that appendix. Thank you very much, Chair. Committee are asked to comment on the high-level summary of the risk register and on the detailed risk register, note the ongoing work in relation to changes proposed and reported to PAC back in June, and to note the position set out in the action plan arising from the annual risk review, and finally to note the inclusion of that summary of children and families corporate risk register to provide an overview for the committee. Thanks, and I'm happy to take any questions.
Thank you, Marie. First of all, you referenced the waiting for the sign-off on the integration scheme. Do we have any update on how long that's going to take?
So all of the queries have now been worked through, and Colin, the Council Governance Officer, is working through those final changes to the integration scheme, and we hope it will be back with Scottish Government very soon.
Thank you. I think it is absolutely correct to bring in children and families into this at this stage, despite the fact that it hasn't been signed off. So thank you for doing that. Anyone else got any questions or comments? I'm not seeing any hands and I'm not seeing any lights. So can we agree the recommendations which Marie just read out? So I'll not repeat them. Oh, sorry.
Sorry. I was just going to ask Ewan, we've got Ewan Murray with us now, the Business and Governance Lead. It's very early days, it's only week 5 for him. So I was just going to ask Ewan maybe just to give a wee comment on some of the planned work around the risk register. I know that's been outstanding for some time, so I know that's something Ewan's been thinking about over the past week. So he might comment briefly just on the work that's going to be coming. Thanks.
Thank you, and welcome, Ewan.
Thank you, Chair. I've, to this point, done a bit of a desktop review of what's needed done, and obviously there's been few outstanding actions for a while around risk, and that's a position we can't continue to be in. So there's a few bits I am focused on. One is just the structure and the presentation of the strategic risk register as it stands is very busy. So bit of work around how I think that should look going forward on the basis of having something that's really easily digestible for members, acknowledging limited time, and something that gives you really quick understanding of the strategic risks and the mitigations in place. Need to align that with the review of the risk strategy and the outstanding work around risk appetite statements. There'll be a bit of work required with the board around just understanding the concept of risk appetite and getting to a position where we can agree risk appetite statements and reflect that in our risk management processes. And obviously the bit around outstanding reviews needs to be taken forward and putting a plan in place to address those. So you should start to see from this point going forward that work coming into place in a way that's done with board members, but also supports your role as board members and committee members to discharge your accountabilities in terms of risk management. Thanks.
Thank you, Ewan. I'm all for more digestible and more transparent, so I look forward to seeing the products of your work. Could you maybe give us just an idea of the kind of timescale in which you expect to be bringing that to us?
Yeah, yes, absolutely. So there's quite a lot of that. We need to be in a better place by the end of this financial year. That's the time frame for that work around, particularly the presentation of the risk register and risk appetite statements. We will need to integrate children and families into the strategic risk register at an appropriate point of time, which is determined by the approval of the integration scheme. And I guess the third wave of that is the strategic risk register is the risk of not achieving the strategic plan objectives. So as we go through the process of developing and agreeing a revised strategic plan, we'll need to review the strategic risk register against that at a suitable point in time as well. So it's getting our ducks in a row to be able to do all that effectively and efficiently. Thank you.
So within this financial year, that's what I wanted to hear. Thank you very much. Anybody else got any questions or comments for Ewan or Marie? In that case, I'll go back to the recommendations, and since Marie very kindly read them all out, I'll not repeat that. Can we agree the recommendations? I assume silence is agreement. Okay, thank you very much. And if we can move on now to the next item on the agenda, which is the governance statement improvement actions. And I think this is yours.
Yeah.
Again?
Yeah, yes, me. Thank you. This is the regular update of the governance statement improvement actions. So as part of the annual accounts, the governance statement identifies a range of improvement actions. So this report just monitors the action against these. So in relation to the integration scheme, since last reported, obviously I've just updated that the queries have all now been worked through, and they're sitting with the Council's Governance Officer to update the scheme and return that to the Scottish Government. And for other internal and external audit actions, previous actions marked as complete have now been removed from the Appendix 1, and updates have been provided for all of the remaining actions in Appendix 1. I won't go through them in detail, Chair. I'm hoping I'll take that as read, but I'm happy to take any questions on that or the appendix. Thanks very much.
Okay, thank you very much. Does anyone have any questions or comments? Oh, we're galloping again. Okay, thank you. And I asked about the assurance, sorry, the integration scheme earlier on, so that's already been covered. So I have no further questions. So can we return to the recommendations that we have considered and commented on the progress report on improvement actions? Agreed? Thank you very much. So we will now move on to the next item, which is the National Audit Report and Inspections Overview. And again, I think this falls in your bag.
Yeah,
Marie.
I can start, Councillor Hannah, thanks, and then I'll bring in Nicola to look at the inspection reports. So this is the regular report that brings through any national reports coming through and any updated inspection reports as well. So there have been two reports since last reporting. So one is the NHS Forth Valley Annual Accounts Audit, and I've set out the recommendations and key messages between 4.4 and 4.10. So understandably, financial sustainability mentions and financial challenges around NHS. The report has been circulated to members as well, so happy to take any questions on that, but obviously this is the NHS Forth Valley Audited Accounts report. The next one is, I don't know, oh, Sarah's here. So the next one is around improving care experience and delivering the promise. So I don't know whether I might bring Sarah in just to talk through some of the key findings there, if that's all right, before we bring Nicola in. Thank you.
Happy to do that, Chair. So just by way of background, the promise comes from an extensive independent care review, and thousands of care experienced children and relevant stakeholders were listened to, and the commitment is about improving outcomes through systemic reform. So the national report that's been linked to our committee today highlights a number of recommendations for Scottish Government, and they stem from issues that were raised and are covered in the report. such as progress being slow, governance and accountability issues, funding and resources, planning and monitoring, support and commitment. So you will see from the report that is linked for you the recommendations within that. Helpful, I think, maybe for committee to know that within Falkirk we are really committed to keeping the promise. We have our own promise implementation team. That team are funded through whole family wellbeing funding, and they are focused on local developments but very keyed into national work. We're constantly seeking out initiatives and developments to ensure that we have an improving picture for our care experience population in Falkirk. Corporate parenting is absolutely at the heart of what we do, and there is a really clear plan in place for Falkirk, and that is supported by a promise implementation team. And we're seeking to make sure that all partners do their bit to make sure that care experience children and young people and adults have access to the supports that they require to achieve everything that they want to. Hope that's helpful. Thank you.
Thank you, Sarah. Yes, I'm familiar with much of the work that is going on, and it's very much appreciated. I wonder if you could say a wee bit more about timescales again, just to say in terms of making those improvements.
So the promise seeks to conclude by 2030. So the focus has always been for the National Promise team that there will be no promise implementation by 2030 because we will have achieved everything that had been set out. I think it's quite clear from looking at the national report that we've received that there is a further recommendation for clarity about exactly what needs to be achieved then and by when to be able to get us to that place in 2030. So it is there is a lot of work to do. In Falkirk, we have our plans. We obviously need to adhere to the national reporting requirements, and we do that annually. And whenever there are update reports requested from us, we do that. So we do everything we need to be doing locally, working alongside parents, stakeholders, carers, care experience young people. The Champions Board, for example, have identified our own areas that we want to target and achieve. But that 2030 is the promise date that has been set, and we're seeking clarity from Scottish Government in exactly what they want from us to be able to identify that we have performed against particular performance indicators that we currently don't have.
Thank you very much. Back to Marie.
Yeah, so I might just hand over to Nicola now, maybe just to cover the inspection reports. Thanks, Nicola.
Thanks, Marie. Yeah, so in the last reporting period, there's been one Mental Welfare Commission inspection report that's been published, and that's in relation to Lockview Hospital. So that returned 2 recommendations, one in relation to medication being legally authorised and regularly audited, and the other in relation to privacy and dignity. There's also been one care inspectorate visit to Grahamston House, and you'll see in section 5.5 that they were inspected against 3 key questions, and all 3 returned a rating of 5, which is very good. There's also, we finally got the publication of His Majesty's Inspection of Prison Service report into HMP Glen Oakle. So that inspection took place in February this year, but it's taken some time to get the published report out. So this inspection process takes into account HMP Glen Oakle at its widest, including SPS or focusing on SPS, but there is one standard, which is Standard 9, Health and Wellbeing, which is led by the Healthcare Improvement Scotland team. So this relates specifically to the healthcare teams and how they perform within HMP Glen Oakle. So you'll see that there are 6 possible ratings that can be returned from this inspection, the highest rating being good, and that is the rating that was awarded to the healthcare team within Glen Oakle. And it's quite an achievement. It's the first time that any of our teams have had a good, and actually we're the only team in prisoner healthcare team in Scotland to be sitting with a good rating. So it's a really good news story. In the wider report, there are 35 areas of good practice for the establishment in its entirety, and 20 of those actually relate to the healthcare team, so more than half relate to the healthcare staff. And there were 77 areas for improvement in its entirety, but 10 of those relate to the healthcare provision. And they're detailed within your report, and most of those have already been actioned. And just to say that for the next PAC committee, we are planning on bringing a deeper dive into prison healthcare as a whole, and the improvement plan from this inspection report will be included in that as an appendix for committee's information. Thank you.
Thank you, Nicola. I think on the whole, this is a very positive report, obviously. When you say that in relation to Grahamston House, the inspection was overwhelmingly positive, that is quite an impressive description of it. And it obviously has come forward as very good. So well done to all the staff who've been involved in delivering such an excellent service. Likewise, very pleased to hear about the Glen Ochil situation, where it's indicating that it's good, and we appear to be exceeding expectations there. So again, well done to the staff who have enabled such a positive inspection to come forward. As ever, of course, I have to go back to the recommendations in terms of Lochview Hospital, where there were issues that were raised. And I wonder if you could say a little more about the actions being taken to deal with those issues that have been raised.
Yes, of course. So the first recommendation is in relation to legal paperwork required in order to administer medication to people who don't have capacity to accept that. This was similar to a recommendation that was found on one of the other sites, I think one of the Bellsdyke sites. So the team there have ensured that they've got audit processes in place now to ensure that the correct paperwork is in place when needed. And in relation to the second recommendation, that was in relation to privacy and dignity. So there are some, or I think there's maybe one room in Lochview that has got like locks on the door, and what the Mental Welfare Commission were looking for there was more in terms of the risk assessment and care plans, and in terms of when those locks could and should and would be used. So again, the team have just strengthened their practice around that, and there's more audit put in place. But the improvement plan for both these recommendations sits with Clacks and so they'll monitor the progress and ensure that it's ongoing, but the appropriate actions have been put in place.
Thank you very much. I was sure they would have been, but we do have to ask the questions. Roger?
Yeah, just following up on your question there, Councillor Hannah. I just find it a bit disappointing that there's a recommendation when inspectors come to one ward, Hope House ward in Bellsdyke. The same recommendation comes for the next ward down in Trice Park, and the third place to be reviewed is Lochview Hospital, and exactly the same recommendation. It seems that good sharing of response could have been learned and prevented the need for these things to be picked up.
I think that's a very important observation. We shouldn't be dealing with the same recommendations time and again in different inspections. So hopefully the lessons will have been learned for the future. Any other questions or comments? In that case, we'll go back to the recommendations. So we are asked to consider and comment on the content of this report, and I think we can say that that has been done. So thank you very much to everyone. We now move on to agenda item 10, which is the joint inspection of adult support and protection. Work stream 4, supported self-evaluation of escalating concerns practice. What a very, very succinct title. And I think for that, we're on to Gemma. Yes, welcome Gemma, and thank you for coming along today. Could you lead us through the report, please?
Yeah, of course. So I'm here today to speak to you about really a new bit of self-evaluation work, which we had the opportunity to be part of. So a wee bit around background. So following all the inspections of all the partnerships across Scotland for adult support and protection, Falkirk's been in 2022, the Care Inspectorate produced a quality indicator framework, which you'll see on page 9 of your papers there, that sets everything out. Now you can see that covers a wide range of areas, from our leadership and our Adult Protection Committee to our execution of our key processes and how we engage with relevant stakeholders as well. So this report relates to one specific area. It's 5.7, which is included in the middle section around about our execution. How good is our execution around our adult support and protection key processes? And it relates to a distinct service user group. So it's adults where we sometimes find it challenging to apply the 3-point criteria for adult support and protection, or it's not straightforward. And this is something that prior to the quality indicator framework being published, that we'd recognised as an area of need and development in Falkirk. And with that, we had established our Falkirk Escalating Concerns subgroup of Adult Protection Committee in 2021. So a brand new, we took the decision through Adult Protection Committee to establish this brand new subgroup of Adult Protection Committee. So the reason this is included in the quality indicator framework is because the joint inspection partners found through inspection that this was an area of need, but we were already identifying that as ourselves locally. So following that, as part of their continued inspection programme, they set out to deliver an additional work stream 4, which is what this relates to. And what they were looking to do was work with a handful of partnerships across Scotland to test out a new way of self-evaluation, looking at this specific quality indicator 5.7. So they wrote out to all the partnerships to ask for expressions of interest, which we made one because we felt we were in a good position, having started some of this development work and focus since 2021. So we were selected and undertook supported self-evaluation with the Care Inspectorate, Health Improvement Scotland and His Majesty's Constabulary. So it was a tripartite self-evaluation involving social work, health and police. So we had a busy period from January to July this year where we were testing out using the quality indicator framework, but actually doing alongside and with the inspection partners versus them coming in and carrying out the inspection of us. So with that, it was a very valuable opportunity, because what it meant is that we developed new skills and knowledge around self-evaluation and learned how to use tools and techniques, because we were working alongside the joint inspection team. And we involved not just myself and the lead in health and the lead in police, but we really made a conscious effort to involve staff from across our workforce so that they could equally benefit from that experience and being involved in the supported self-evaluation. So what I would say overall, whilst it was really quite taxing because it was a big bit of work on top of already busy roles, it was very valuable. And the outcome, as you can see set out in the report, was a positive one, in that you can see within the report at 4 point, the 10 key elements.
4.8.
Yes, thank you. So you can see the 10 key elements, which really highlights what we were looking at when we were surveying the staff, doing the focus groups, speaking to adults with lived experience, and of course reading the files of people who had experienced our initiative, harm reduction, interagency referral discussions and escalating concerns case conferences, which really rest on us ensuring that we have clear and collaborative escalation processes so that the adults who we do find it tricky to apply that 3-point criteria for adult support and protection don't continuously fall under that threshold, and we miss opportunities to support them, intervene early and effectively, and respond in the ways that they need us to. Trauma-informed practice is absolutely central to this work stream. So across those 10 key elements, we were graded as very good in 2 and good in the remaining 8, which is a positive outcome, and we really hope to build on that further. So included within this, we've got a draft improvement plan. We're looking to develop that further. So we had our subgroup meeting just in advance of Adult Protection Committee a couple of weeks ago, and myself, the Child Protection Lead Officer in the partnership, and the Alcohol and Drug Partnership Lead Officer, we've set aside time next month to focus in on that improvement plan and really refine and develop it. Because as you'll see, when you look at the case characteristics, what we see within this escalating concerns pathway is a much younger profile. So typically, adult support and protection, you're far more likely to be subject to adult support and protection concerns if you're an older adult, particularly 85 plus. But with the escalating concerns pathway, we see a lot of younger adults and young people, and it makes links to the presentation that Sarah was providing earlier on around that continued commitment to care experienced young people and adults who were a feature of our case sample. So that's why myself, Lee Allen and Philip Heaton, the other lead officers, are getting together to refine it, and we'll continue to work with NHS and police around about that. So I think overall, really, I think a positive outcome, not just in the way that we're carrying out this work and the procedures that we have around recognising risks and escalation, but actually we've learned new skills around self-evaluation from being part of this, which you'll see within the report where we want to harness and take forward. So we're in the planning stages of looking at the quality indicator framework and looking at our case conference step at the moment, and we're between this month and March, where we're going to be applying the skills that we learnt to another area of the quality indicator framework. So I could speak about this all day because it's an area that I think is extremely important, and it was a very worthwhile experience, but happy to take any questions.
Thank you very much, Gemma. Yes, we can tell you're enthusiastic about it. So that's what I like to hear. I think it's important that what has happened here is an issue has been recognised and dealt with, and that you're learning the lessons for other similar situations for other areas. And glad to hear about the all-age approach as well, because clearly adult protection is no respecter of age. Any age can be in need of protection. Any comments or questions from anyone else? Well, apart from to say thank you very much indeed for your enthusiasm and the hard work that's gone into this, I will move on to look at the recommendations, which is to note the commitment to self-evaluation, innovation from the adult protection partners and operational staff to resource this 6-month project, and the positive outcome. I think we can certainly note the positive outcome here. Note that further self-evaluation exercise focusing on 5.2 and 5.3 of the quality indicator framework is planned to take place between November 25 and March 26. These areas focus on assessment and management of risk and collaborative decision-making and planning for the safety, protection and support of adults at risk. Can we agree those recommendations? I think we agree the recommendations and look forward to further reports on the other indicators that you're looking at. So thank you very much indeed.
Thank you.
With that, we will move on to agenda item 11, so Clinical Care and Governance Management Group report. I believe that comes to you, Nicola. Oh, sorry, it's you today.
Yeah, it's going to be
Martin
Martin today. Yeah, sorry.
Okay, my apologies. Martin then.
Thanks, Councillor Hannah. Members will be aware that this is the usual report that comes to this committee updating the work of the Clinical Care Governance Management Group. You will hopefully recall that this group gives the operational leadership team oversight and assurance around the delivery of our services. Management group receives reports from 6 subgroups, one of them focusing on community-based services, one of them on bed care services, one locality services, one allied health professions, and one mental health, community mental health teams, primary care mental health services, and other regulated services. The group really gives the leadership team assurances around the safe delivery of our care and support services. It follows the Vincent framework and it looks at, is our care safe today? Has it been safe in the past? Will it be safe in the future? And is it person-centred? Are we learning, improving, and are our systems reliable? The report goes on to really set out the areas that were considered at the last management group meeting. We considered a couple of deep dives, which are actually on the agenda for committee today, one in relation to shifting the balance of care and the other in relation to housing with care. And we considered some learning from adverse events learning reviews. We also discussed in some detail the external inspections already covered in the previous agenda item, and we looked at the action planning arrangements in terms of the previous Mental Welfare Commission inspection at Glenaukle. The recommendations from that are set out in the report. In terms of identified risks, we discussed the ongoing risk around recruitment and retention, and the report indicates some work that's been undertaken in relation, particularly around occupational therapy and the development of a team. That in itself has actually enabled us to ring-fence work for occupational therapists in terms of social care activity, and already we're beginning to see significant progress in terms of them dealing with the waiting list for OT assessment. And actually, the initial indication are that actually it's viewed as a real positive by staff looking for roles within the service. And I'm told that our recent recruitment activity around occupational therapy is really successful. So we're going to plan to evaluate that in the next couple of months, and would be happy to bring an update to a subsequent committee. Other areas that we considered, we had a focused discussion around a particular care home within the Falkirk area that had some concerns that were highlighted by the Care Inspectorate, and we were assured that actually our local teams were working with that provider to improve the quality of care and deal with the challenges that the Care Inspectorate had identified. I'm happy to take any questions. However, ultimately I have to say the leadership team were assured that our services are safe and that they are being appropriately managed and that they are responding to challenges. Thanks.
Thank you, Martin. Glad to hear that our services are safe and responding to challenges, obviously. Does anyone have any questions or comments on the report? Roger?
Yeah, I'm going to just pick up on the term safe, because safe is a relative term and it's not absolute. And you can't do work like this to be 100% safe. And I think we all need to acknowledge that when you're balancing risks, isn't one way. There are going to be times when things happen which aren't or you wrap people up in cotton wool, which isn't what we want to do either. So I think we've got to respect the difficult work of frontline workers who are trying to balance those risks sometimes and be upfront with that.
Thank you. That's a point well made, and we're looking forward to looking at the risks. Again, yes, there is no situation that is without risk. We have to live with that. The question is, how much of a risk are we willing to accept, rather than that there is any situation where there is no risk. Anyone else got comments or questions? As you pointed out, we will be coming on later on to looking at shifting the balance of care and the housing with care, so we can leave that to later. I don't think I had any other questions, so I would move on to the recommendation, which is to consider and comment on the updates provided within the report. Can we accept that we have done that? Yes? Okay, thank you very much indeed. That takes us on to agenda item 12, which is the assurance report from this committee to the IJB. We will be coming on to look at a deep dive on a couple of areas later on, so there may be a need to add some things to it later on, but it would be useful if Gail could give an idea of what she would consider in terms of what we have already covered would be suitable.
Thank you, Chair. Yes, I was going to suggest that we think about this at this stage in the agenda in terms of are we assured, and then we'll maybe come back to that question after the two private items as well. So just a question, I suppose, as committee members, are you assured that the information that you've heard and seen today provides an appropriate level of assurance?
Are we assured? I see nods. So yes, I think we can say that we are assured.
So as ever, it's obviously down to committee members what they want to raise through to IJB, but a couple of suggestions that you might want to consider from what we've considered already, and I might suggest some things after the next two items as well. So the first one is around the audited annual accounts. So the PAC considered and approved the audited annual accounts is probably helpful for the IJB to be aware. And the result, the PAC members also noted it was a really positive audit report, albeit highlighted the significant financial pressures which continue to be challenging. So that's one suggestion. Another suggestion is around highlighting the National Audit and Inspections Report. And the PAC noted the recent inspections, including the HMPIS inspection report into HMP Glenacle, for which the Prison Healthcare Services, the overall rating given was good, which is an improvement from the previous satisfactory rating. And it's the first prison healthcare team in Scotland to be awarded good since the inspection process commenced. Also noting that Grahamston House received a positive inspection with overall overwhelmingly positive feedback. And assurance was sought around delivering the timescales for delivering the promise in Falkirk, and assurance was also sought around the actions being taken in relation to the recent inspection at Lochview. So those are two suggestions, but again, it's up to the PAC committee members what they would wish to highlight.
Well, thank you, Gail. I think certainly those things should all be highlighted. The only other thing I would say is, particularly, I do think that it's worth making mention of our congratulations and thanks to the staff who have ensured that we were able to have those very positive reports. I think that needs to be said. Sometimes we take these things for granted. Any other things that people think should be highlighted? I think it is worth, in terms of the sustainability issue, kind of commenting a little bit more strongly about the problems that are related to our financial situation, given that it is so very dire. I think I would like to hear that a bit more loudly. I know it's something that we are hearing again and again and again, but I do think it needs to be emphasised. Any other additional comments? Roger?
Yeah, just on one of those points, I think Sarah's team with the promise has despite the cutbacks and the hardships of financial hardships, hearing from frontline workers just how positive they feel about the implementation of the promise, and that feedback is is really heartening in these difficult times. So well done to those folk.
I think that's a point well made, and I apologise, Sarah, for not adding that one in. I think it is well worth a mention, and particularly in relation to children and families now being new to this board. So I think that's important to welcome the work that's being done in relation to achieving the promise. Anything else? In that case, I will say that brings us to the question of item 13, the exclusion of the public. If so resolved in terms of, I will not, it is in the supplementary agenda, what has been put forward. Essentially, I need to ask the committee if we agree to the exclusion of the public for the subsequent items. Essentially, the reasons are that the next two items contain information which could identify individuals, and we cannot have that discussion in public. It's also important that board members and committee members feel free. This is about a deep dive into two particular issues, and we have to feel free to say honestly what we think and to dive into the reasons for what has happened without jeopardising confidentiality in relation to certain individuals. So do we agree to the exclusion of the public for the subsequent items? I'm hearing no one saying no, so I will assume that that has been agreed. So I would ask if we could just take a few minutes to check that the IT system is excluding those members of the public who are online.